Congratulations on your deployment tasking here to Bagram, Afghanistan. I'm Colonel Gianna Zay, the commander of Craig Theater Hospital, and I want to welcome you. What a great opportunity you've been given to be part of an expeditionary medical group. This video was created by outstanding medics. The idea was to prepare you for your deployment. The video covers great things like travel, what you should pack, potential resources here on base to include the BXs, bazaars, and Wi-Fi. Duty expectations will be outlined, as well as your living quarters. We're excited to have you part of the team, and welcome aboard.
So packing for deployment can be really stressful. However, if you take the time to think about the toiletry items that you use each day, it might become less of a strain. List the items that you use daily and how much you utilize in a month. Times that by the number of months that you've been tasked for your deployment. Purchase the items in bulk. You may consider shipping ahead of time, but however, please arrange that with your flight. Normal delivery times range anywhere from 10 to 14 days. Your flight will obtain your box and secure it until you arrive.
While en route to Bagram, you'll make a few stops. This gives you the opportunity to stay in touch with family, friends, and coworkers. You may want to procure a European power adapter to make sure you can keep your electronic devices charged. When you're on your trip, make sure to rest whenever you have the opportunity and eat well, because you may be compensating for a 12-hour time zone change. Stay hydrated and take care of yourself so that jet lag isn't a factor and you're ready when you get to Bath.
The average trip to Bagram can take from 5 to 7 days from the States. During your travel, you will make multiple stops. In addition to the readiness items that you are issued at your home base, you will be given 2 additional bags during the trip along with your body armor. To balance the weight that you will be carrying, pack as lightly as possible, and using the address sent to you by your projected unit, forward any items that are not of immediate need. Be mindful that the running water on bath is chemically processed and tends to dry out clothing, hair, and skin. You might want to bring a fabric softener along with moisture-rich shampoos, conditioners, and body lotions to balance the potential effects of the water.
When you make those stops along the trip and you have the opportunity to call home, there are several free smartphone apps that you can use that might assist in your international communication. Be mindful though that recipients must also have these apps downloaded. Purchasing a local Wi-Fi network is an option once you arrive in Bagram. There are 2 free Wi-Fi connections that cover the Craig Joint Theater Hospital facility. Also, the Air Force Wi-Fi network is available throughout the dormitory. In addition, free morale call lines have been installed in the facility for your usage in the Holy Joe's Cafe.
Bagram has 2 BXs, and one of them is in close proximity to the hospital compound. However, be advised that the BXs on base stock very minimal items, and in most cases, these items are from a single vendor with limited selection options. For example, laundry pods, hair gel, and the collaboration of other items are not sold at the local BXs here on Bagram. Here are a few items that you might want to bring. In addition to the BX, there will be opportunities to purchase various items at the base bazaars. A bazaar is a collaboration of multiple Afghan shops who offer goods and services. Many of the items are specific to the Afghan culture and would make great gifts or souvenirs.
Along with the free Wi-Fi, local dining facilities, BX, and bazaars, the Med Group is fortunate to have a self-serve free laundry facility conveniently located inside of the hospital. One load of laundry will take you about an hour to complete. The base has several gyms that you can also choose from to work out at. But another fortunate thing is that the hospital also has its own gym with numerous workout machines as well as free weights to meet your fitness needs. Also located in the hospital is a nutritional medicine cafe that has a healthy variety of food options, but the dining facilities are located within walking distance. The dorms are located only footsteps away from the rear entrances of the hospital in a T-walled compound. Your dormitory life may consist of 4 to 7 roommates. The rooms have 4 sets of bunk beds where each person will have a wall locker. You are free to decorate your room in your own style as long as it displays cleanliness and is in compliance with fire and safety guidelines. We maintain a strict 24/7 quiet hours. It's because people work a variety of shifts. Now, let's visit a few sections to give you an idea of what it might be like in your workplace.
The radiology department in Craig Joint Theater Hospital consists of 2 CT rooms, 1 X-ray room with a floor tower, and 1 ultrasound room. We also have 3 portable X-ray machines along with 2 C-arms for the OR. There are 3 shifts covering 24/7 operation. Because of the wide range of services available, it is highly recommended for all inbound staff to be familiar with CT protocols, trauma X-rays, and C-arm operations. Welcome to the radiology department.
Welcome to Craig Joint Theater Hospital Pharmacy. We're 24/7 operations. Our mission is critical here to the hospital because we provide traumatic and acute therapies to those patients seen here. We average 4,000 prescriptions per month, which consists of 2,000 outpatient and around 1,000 sterile IV products to all clinics and wards here in the hospital. If tasked to the pharmacy, you will find it a rewarding experience both professionally and personally. Welcome to the team.
The intensive care ward provide Role 3 care to the U.S. military and coalition forces, Afghan Army, police, security forces, U.S. civilian contractors, and local nationals. Our patient ages can range from infant to geriatric. We consist of a 16-bed unit with an expansion capability of 30 in the case of a massive casualty emergency. We treat a wide range of injuries, including battle, non-battle injuries, disease, and humanitarian elective surgeries. We have 4 Afghan translators who foster communication between the healthcare team members and the patients and guardians. They translate written discharge instructions to the patient in their local dialect. The patient guardians provide support to the patient, and they also take a part in their care. Our patient census can vary from 1 to 2 patients and rapidly surge to 6. Historically, we have a higher patient census from May through August. Average length of stay is 72 hours, but can increase depending on the patient's status. U.S. coalition forces are typically transferred within 1 to 2 days, while local nationals, Afghan Army patients can remain here for weeks. Welcome to the team.
As a member of en route patient staging, you will have the opportunity to care for and transport patients who have obtained battle and non-battle injuries, as well as critical and non-critical patients to a higher echelon of care. You will work closely with the aeromedical evacuation and critical care air transport teams when it comes to moving your patients. When transporting your patients to the flight line, your team will load patients onto the AMBUS and then offload directly onto the aircraft. There will also be times that you will receive patients from surrounding bases. You would receive notification of inbound flights, and upon arrival to the aircraft, you will greet your patient and transport them to the medical facility. Many sections in and out of the hospital are unable to experience what we do on a day-to-day basis. So when we have patients on litters, many personnel are enjoying assisting us as manpower. We run a 24-hour ops, which is currently split between 2 shifts. The shift arrangement may vary depending on your rotation's needs. This is a very rewarding job, as you are one of the main reasons that our heroes get to make it back home safely. Welcome to Bagram, and welcome to the new position on the team.
The Craig Joint Theater Hospital Outpatient Clinic OPC delivers routine and acute medical care for all U.S. military, civilians, and local nationals and NATO forces. OPC is responsible for administering immunizations, managing the fresh whole blood bank program, manning the mass count minimal team and triage team, and medically out processing based personnel. In addition, we support 4 specialty clinics, which are the OBGYN clinic, cardiology, physical therapy, and behavioral health. We also support 3 surgical units, ophthalmology, urology, and ENT.
As a medtech, you'll be performing various duties such as blood draws, IVs, medication administration, stress tests, and minor procedures such as ear irrigations, toenail removals, suture placement, and removals. The clinic is open during the day shift hours for walk-in care. Welcome to the team.
The Craig Joint Theater Hospital ICU provides care to the U.S. Forces, Coalition Forces, contractor, and the Afghan Army and Police, to include injuries that are threatening to loss of life, limb, or eyesight. The ICU consists of 9 beds with the expansion capabilities to 13 in the event of a mass cow. All the beds can be centrally monitored at the nurses station. The PACU, which is the post-anesthesia care unit, is also part of the ICU. Therefore, we provide pre- and post-operative care for each patient that has surgery. The PACU consists of 4 beds, however, can expand to 6. Though things have slowed down, our census can be from 1 to 2 patients and rapidly expand to 6. Our patient diagnosis can range from gunshot wounds, IED blasts, to cardiac conditions or anaphylaxis reactions. The average length of stay for a U.S. Coalition patient is 1 to 2 days. However, the local national patients can sometimes stay 3 to 5 weeks. In the event of a mass cow, we also provide manning for the ER, Immediate Response Team, the Blood Bank Team, and the QRF, which is the Quick Response Force. Welcome to the team.
The Craig Joint Theater Hospital ER is one of the Role 3 emergency departments in the AOR. We have 13 beds, which consist of 6 trauma beds and 7 general patient beds. We provide care to approximately 200 patients per month. The majority of our workload is comprised of U.S. Coalition Forces with GI or orthopedic complaints. However, our mission is to provide stabilizing care for our trauma patients. Currently, the majority of our trauma patients have been Afghan Army, police, and local nationals. When there are multiple traumas, all ER staff are on call 24/7. When you arrive, you'll spend most of your time training as a team. You'll learn where everything is located, duty protocols, and procedures. When we have downtime, we will focus on personal and professional goals. Working in the ER is a rewarding experience. Make the best of your time here. Welcome to the team.
The mission always comes first. However, in the event that you have a little bit of downtime, you might want to change up your routine. The hospital's morale committee is a great place to start. Our committee is a combination of officers and enlisted members that facilitate events to boost your Bagram experience. Our rotation has had events from karaoke to dance night, holiday party celebrations, and even a combat cook-off. Remember, your morale events will be dependent upon your rotation's ideas. In addition, the Wing and the USO host a wide variety of base-wide events for your entertainment.
Whether this is your first deployment or your 5th, I can promise that you'll learn something new each and every day here, and you'll get out of it whatever you put into it. Think of some goals you'd like to achieve while you're here, and then work towards them, as you'll probably have time to make them a reality. You'll also likely be challenged while you're here, but if you come with the right attitude and give the team 100%, it will be much easier to overcome those challenges. We hope that this video has given you a better picture of what to expect in your upcoming deployment. We look forward to having you as part of the team.